This video is for educational purposes only and is not a substitute for professional medical or mental health care. If you're experiencing distress or need individualized support, please reach out to a qualified healthcare provider.
Hi, I'm Jacqueline Fisher, a trauma-informed therapist, educator, and the founding CEO of Focus First Counseling and Education, Inc. I help people turn pain into purpose, and this series is part of that path. I'm also a licensed marriage and family therapist, certified in EMDR and psychedelic assisted therapies, with decades of experience supporting individuals and communities on their healing journeys. This educational series is brought to you by Focus First Counseling and Education, Inc., a 501c3 nonprofit organization in Blythe, California, and made possible through the support of the WRAP Foundation, whose mission is to strengthen nonprofits and community wellness. Together, we're creating conversations that reduce stigma, promote healing, and offer accessible tools to support mental health and emotional well-being. So, whether you're here for yourself, your family, your clients, or your community, you belong in this conversation. Let's begin with something simple but powerful. Mental health is health. When we talk about physical health, we think about basics: rest, movement, nutrition, hydration, fresh air. And we accept that staying well requires regular care, not just crisis intervention. The same is true for mental health. Mental health is not only about preventing breakdowns or treating diagnoses, although those things matter. It's also about tending to the whole person every single day. I often ask my clients, would you expect to have a good day if you hadn't eaten the entire day before? Of course not. You'd be hungry, irritable, foggy, less patient. The same thing happens when we don't nourish our mental and emotional well-being. We're human. We get overwhelmed. We get stuck in our heads. We carry stress longer than we realize. And tending to our mental health, just like eating when we're hungry, helps us show up more fully for our lives. So, what does caring for mental health look like on a day when you're doing okay? It might look like stepping outside for fresh air, creating a pause between tasks, reaching out to someone without a crisis as a reason, or simply checking in with yourself and asking, what do I need right now? These small moments of attunement keep us anchored. They strengthen our baseline, so when hard days come, we're not already depleted. Throughout this series, I'll reference books that shaped how I understand mental health. One that deeply influenced me is The Body Keeps the Score by Dr. Bessel van der Kolk. He reminds us that being able to feel safe with other people is one of the most important aspects of mental health. That truth often gets lost in a culture that rewards pushing through instead of pausing, and burnout instead of boundaries. We tend to associate mental health with what's wrong: depression, anxiety, trauma, addiction. But mental health is also about what's strong. It's our capacity to cope with stress, to stay grounded during change, to stay connected in our relationships, to notice when we need help, and to know where to turn. Mental health is how we care for ourselves, our whole self. It's not weakness, it's maintenance. Just like brushing your teeth, just like stretching a tight muscle, it's dynamic. It shifts with what we're facing, what we're feeling, and what kind of support we have access to. The more we understand this, the easier it becomes to let go of shame. We begin to see that caring for our mental health is not a sign of being broken. It's a sign of awareness, courage, and self respect. You don't have to wait until you're falling apart to ask for support. You're allowed to care for yourself and for your mental health every day, especially on the days when you're doing okay. That might look like walking in nature, watching the sunrise or sunset, taking a few minutes to check in with your body, or practicing something as simple as offering yourself encouragement instead of criticism. Small steps add up to big shifts. So let's try something together now. If it feels safe, allow your eyes to close or your gaze to soften. Let your attention turn inward. Notice your breath without changing it yet. Then inhale gently through your nose. As you exhale, let your shoulders drop. Unclench your jaw. Let the exhale be long and complete. Again, inhale through the nose and a slow, full exhale. Allow whatever you were carrying into this moment to soften just a little. Feel the support beneath you, the pull of gravity holding you here, your body being held without effort. Notice the sensations in your skin, muscles. Notice the air leaving your lips and entering your nostrils. Now begin to notice sound. What do you hear close by? And then further away. Allow your awareness to widen without strain and gently begin to bring your attention back to yourself. When you're ready, open your eyes. This ability to settle, to come back to the body, is one of the most powerful antidotes to stigma, because stigma doesn't just live in our thoughts, it lives in our bodies. So let me ask you something. Do you know what stigma actually is or where it comes from? Stigma doesn't begin inside us. It begins around us, in culture, in silence, in systems that taught people to survive by suppressing their vulnerabilities. In many families and communities, especially communities that faced ongoing threats or marginalization, talking about mental health wasn't and sometimes isn't safe. You kept going back because you had to. The silence was not weakness, it was protection, but it came at a cost. Healing involves discomfort, but so does refusing to heal. And over time, refusing to heal is always more painful. Many of us were raised in environments where refusing to heal was normalized, even admired. You were told to tough it out, to stop crying, and to be strong. But that version of strength often required disconnecting from the body and silencing emotional truth. Dr. Gabor Mate explains it this way. We live in a society that pathologizes normal responses to abnormal circumstances. In other words, many symptoms we label as illness are actually intelligent responses to pain. But instead of understanding that, people are judged, labeled, and dismissed. That's how stigma becomes internalized. And when stigma is internalized, it shows up physically. Tight chests, held breath, clenched jaws, tense shoulders. That's not failure. That's the nervous system trying to protect you. When we slow down and notice this, something begins to shift. We begin to change the story, not just in our minds, but in our bodies. And if we want to end mental health stigma, we have to change how we talk in our families, in our workplaces, in our communities, and in our own minds. Many of us inherited scripts like struggling means you're weak. If you need help, you're failing. Just push through. You got this. But what if the truth sounds more like Struggling means you're human. Asking for help means you're wise enough to know you don't have to do it alone. Caring for your mental health is strength, not shame. We got this. Language shapes belief. Belief shapes behavior. When we change our language, we loosen stigma's grip. Here's a phrase you can borrow when old messages creep in. I'm not broken, I'm breaking through. Say it when growth feels uncomfortable. Say it when healing feels lonely. Say it when you're doing something new. Before we close, I want to leave you with two reflections. How do you respond when someone opens up about their mental health? Do you make space, or do you rush in to fix it or dismiss it? And what do you fear others might think if you spoke honestly about your own mental health? You don't have to answer that out loud. Just notice what comes up for you in your own body, in your own mind. Because healing begins when we tell the truth and allow others to do the same. And that is how stigma loses its power.
This video is for educational purposes only and is not a substitute for professional medical or mental health care. If you're experiencing distress or need individualized support, please reach out to a qualified healthcare provider.